Hello, ladies and gents. Welcome back to Anatomy and Pathology. In today's teaching session, we will be covering three pediatric pelvic pathologies. These are SUFE, which stands for Slipped Upper Femoral Epiphysis, DDH, which denotes Developmental Dysplasia of the hip, and finally, Perthes Disease. However, before we can learn about these pediatric pathologies, we must know what a pediatric bone looks like, as it's very different to the makeup of adult bones. Let's dive in. Here we have an example of a pediatric femur. We start at the top of the femur bone, which is where the epiphysis sits. There is also an epiphysis at the distal end of the femur, but for the purposes of this video, we will just be focusing on the proximal aspect, i.e. the hip. The epiphysis of the hip is the part of the bone which sits in the acetabulum, in other words, in the hip socket. The epiphysis is filled with osseous bone materials. Below the epiphysis, we have the metaphysis. The metaphysis contains the epiphyseal plate, which is also referred to as the growth plate or the physis. Below this region, we have what is known as the diaphysis, which is effectively the shaft of the bone. Now we know what the femur bone looks like before reaching skeletal maturity, we can take a look at today's pathologies. So first, we have SUFE. The name of this pathology really does give it away. It is a slip of the femoral epiphysis, usually in a backward direction. The cause of this pathology is unknown. In terms of risk factors, obesity and hypothyroidism can put you at more risk of developing the pathology. Symptoms include hip pain and referred knee pain, which is a common symptom. Furthermore, patients have an inability to weight bear and have a reduced rate of movement. The orthopedic team will usually be looking after someone with SUFE, and they will probably end up having an internal fixation procedure involving cannulated screws in order to stabilize the affected hip. Potential complications that may arise with SUFE involve osteonecrosis of the hip, and also at heightened risk of developing osteoarthritis of the affected hip. Now let's move on to the radiographic features of SUFE. We are now going to take a look at the radiographic appearance of SUFE, so you will be able to spot it if you ever see it on a radiograph. Here we have a radiograph illustrating a slipped upper femoral epiphysis of the right hip. We can visibly see that the right epiphysis has slipped in relation to the metaphysis of the bone. You will be able to easily distinguish this when comparing it to the left hip, which is unaffected. However, for SUFE presentations that are a lot less obvious, we will need to use our radiographic indicators to assess for SUFE. We can see that the right hip epiphysis is noticeably smaller than that of the left hip. It is not actually smaller, but this is a projectional illusion due to the fact that the epiphysis has slipped out of place. This is our first indicator of SUFE. Next, we can use Klein's line of assessment in order to test if this right hip represents SUFE. Klein's line is a line drawn vertically from the neck of the femur up the proximal femur. If it does not intersect with the femoral head, then this is a positive indicator for a slipped upper epiphysis. We have drawn the lines on both hips so that you can see the difference. We can see that on the right side there is no intersection with the femoral head, therefore indicating a slip. On the left hip, we can see that our line does indeed intersect with the hip, and it is therefore unaffected. Next, we can take a look at our growth plates to judge for SUFE. We can see that the right hip growth plate is significantly wider compared to the left hip, in essence separating the epiphysis from the rest of the bone. All of these features provide a definite diagnosis for a right hip slipped upper femoral epiphysis. Here we have another radiograph, this time demonstrating bilateral slipped upper femoral epiphysis. I have included this image to show that SUFE can affect both hips, and the condition is not just limited to one hip. Now let's move on to developmental dysplasia of the hip. DDH, or developmental dysplasia of the hip, is when the hip of a newborn baby is dislocated or is susceptible to dislocate in the future. hence the name developmental dysplasia of the hip. This condition is usually congenital, which means that it is present even before the baby is born. The baby will be at increased risk of contracting this disorder for a number of reasons. Usually, if there is a family history of DDH within the family, there is an increased risk of developing DDH. Females are also more likely to developing DDH at an 8:1 ratio over males. Other risk factors are related to complex pregnancies and pre-birth factors such as being a twin, being a firstborn, or also complexities within the utero that may cause the baby to have DDH. There are some treatments available for this pathology whereby a hip spica or brace will be used to immobilize the affected hip into place. Various complications can arise with DDH, such as one leg being a different size to the other, and also limited hip movement as the baby gets older. Let's move on to the radiographic features that represent DDH. Here we have a radiograph illustrating DDH of the right hip. When first looking at the image, we can see straight away that the right hip is not sitting correctly within the acetabular cavity. This is an obvious characteristic of DDH, but there are some other indicators which will help us diagnose this pathology. If we compare the right epiphysis size to the left, we can see that it is significantly smaller. This is irregular, and in an ideal world, both epiphyses should be ossifying at the same rate. This is another characteristic representation of DDH. Lastly, we can see that the acetabulum on the right has an irregular appearance as compared to the left. The roof of the acetabulum is more shallow and it is almost angled vertically as opposed to having its usual well-rounded appearance. These are the characteristic representations of DDH. We will now move on to our final pediatric pelvic pathology, which is Perthes disease. Perthes disease is caused by a disruption to the blood supply of the femur. As a result of this, osteonecrosis of the femoral head occurs, and this affects its structure and function. The cause of this process is unknown to date. Sufferers will present with a number of symptoms such as pain in the affected area or limping. There are treatment options that are available for Perthes, such as surgical and non-surgical methods. The primary goal will be to maintain the hip formation to be as close to as regular as it can be in order to maintain hip function. It is very important to mention that there are 4 stages of this disease process. Number 1. Femoral head necrosis. This is a fancy way of saying that the bone tissue begins to die as a result of the lack of blood reaching the area. Number 2. Fragmentation. Bone is reabsorbed when the femoral head begins to collapse. Number 3. Reossification. New bone growth occurs in order to reshape the femoral head. Number 4. Remodeling. The femoral head will begin to reshape into a spherical shape. Let's take a look at some x-rays to show you how this disease manifests from a radiographic perspective. This is a demonstration of Perthes occurring bilaterally on both hips. Due to the complex bone changes that occur in this disease process, there are a lot of features that we can use to identify it. We can firstly see that the epiphyses on both hips are of varying sizes. We can also see that the femoral head on both hips has become more of an oval shape as opposed to its regular, more rounded appearance. This is because the disease causes the femoral head to become wider and flatter. Another characteristic representation is that of the growth plate. We can see that the physis has become blurred and it is difficult to evaluate where the exact lines of the growth plate are. Finally, we can see evidence of fragmentation in and around the joint. This is as a result of ossification of old and new areas as the body tries to remodel the hip into its correct appearance. And with that, we have reached the end of this video. I hope you now have a better understanding of SUFE, DDH and Perthes disease. If you like this video, Don't forget to subscribe, like and share. See you in the next video.